Cancer doesn't discriminate. Our next guest knows this all too well. She's a breast cancer surgeon who found her own lump. Dr. Ann Peled is here to share the story of how she became the patient. And Dr. Peled, thank you so much for coming and sharing your very unique story. Can you explain a little bit about your story, how this is something you usually treat?
Yeah, I mean, as you said, it was a total surprise. Back in November 2017, I felt a breast lump, and I'm 37 years old, no family history of breast cancer. I assumed it was gonna be a cyst or something normal. And I gave it 2 weeks, and when it hadn't gone away, I decided to take the advice I give my patients, which is you shouldn't leave something, you should get it checked out. And I remember so distinctly getting the call from the pathologist that it was invasive breast cancer. I was really surprised. But honestly, after that first call, I felt incredibly lucky every step of the way. I got great information from a test called an oncotype test, which helps tell you how aggressive your cancer is. And mine was incredibly low, lower than I could have hoped. And that bodes really well for me long term. And my genetic testing was negative. So I was able to have a lumpectomy and reconstruction back in January, went on to radiation, and have now been cancer-free 6 months as of this past week.
So you went through the entire algorithm that you do day in and day out.
Yep.
That is your job that you do for hundreds, if not thousands of patients. But you had to make decisions as the patient. How was that?
So I have to say I had no idea how hard decision-making was going to be until I was in that place. But it's really changed how I interact with my patients because I now understand how difficult decision-making is. I help them think about what their options are going to be in a totally new way. And for me, once I found out I was going to do well with my cancer long-term, I realized how much my recovery mattered to me. I have 3 little kids, I have a crazy practice, I'm an athlete. How was I going to get back to that? And I got so lucky. I have a fantastic surgical team. They let me get back on my bike in a week. They gave me this phenomenal recovery system, which is called Prevena. It's an incision management system. It helped me get back to my working out, helped me heal faster. So now for my patients, I try to do the same thing.
And able to avoid chemotherapy, I may add.
Completely, which was huge because at 37, even 10 years ago, everyone would have given me chemotherapy. But we know that at this point we have those data. We do, and they're real.
Based on markers, we know when
Right.
the chemotherapy is indicated and when long-term studies show that outcomes are not affected if you add the chemo.
Someone with an average risk of cancer, we know that there are different guidelines giving different recommendations as far as when you start screening. So 40 years of age, 45 years of age, how frequently you screened, every year, every 2 years. I'm just curious, what are your thoughts?
So in my mind, I think we look at big data and it's really helpful for on a population level. It doesn't actually, to some extent, translate to the actual person. So for me at 37, screening wasn't even on my radar.
Yeah, you never had a mammogram.
So I think for me, when you're young, you want to be doing your exams. You want to be seeing your gynecologist, having them do exams. But in my mind, screening every year, you know that you might have an increased risk of finding something, but you're more likely to find something if it's bad. So I recommend my patients at 40 get screened every year, and even earlier if they're higher risk.
Before we go to break, what's the biggest change you've noticed as a physician since you became a patient, basically for the very thing you treat?
The feeling of what it's like to tell people they have breast cancer, just knowing exactly what that feels like in a way that I never knew before, that has struck with me every single week. I'm telling multiple women they have breast cancer, and to know what that feels like, to know how important it is to call people as soon as you have results, because that waiting is so painful. For me, that's really changed the way that I practice, and I connect with my patients in a way I never did before. And it's made my job, to be honest, the silver lining of it, it's a lot more rewarding than it was before, quite honestly.
I think you were a super doctor.
Yeah, it's obvious you have a wonderful bedside manner, and keep up the great work. We're so happy that you had a good outcome
Thank you so
with
much.
your cancer, and keep up all the good work.